for the quick evaluation. And saying that, I'm going to go ahead and introduce our speaker. We're so pleased to have Brianna Chang. She's a registered dietitian nutritionist who is passionate about educating and equipping patients with tools to promote health and nutrition. She graduated from Pepperdine University with her Bachelor's of Science degree in nutrition and continued her education at Pepperdine, where she completed her postgraduate dietetic internship, serving at community sites throughout Los Angeles. She's worked in dietetics for 7 years across inpatient, outpatient, and private practice settings. And during the past 5 years has further developed her career working specifically with oncology. She currently splits her time working with patients at Torrance Memorial's Inpatient Center and the Outpatient Center. And she teaches a monthly cancer nutrition class to the community. She enjoys finding new opportunities to engage with patients about nutrition. So please help me welcome Brianna Chang. Thank you so much for being here.
Thank you, Nancy. So like Nancy said, my name's Brianna. I am a registered dietitian nutritionist at Torrance Memorial. I'm very excited to be with all of you tonight. So we will go ahead and get started. I'm just going to share my screen. All right, can everybody see? All right. So tonight we're going to be discussing functional foods, antioxidants, and their potential health benefits and the role that they play in lowering overall disease risk. And specifically, we're going to focus a lot on reduced risk of cancer. So first, what we'll be discussing tonight is what exactly are functional foods and antioxidants. These are words that get used really often. So I'll start by just giving a little bit of background on each and help further your understanding of what they are and what the differences are. And then we will talk about types and examples of each and foods that contain antioxidants. We'll also talk about the potential health benefits, their role in cancer and disease prevention. And lastly, I'll provide some practical tips on how you can incorporate functional foods and antioxidants into your diet. So first off, we'll get started by just talking about what exactly is a functional food. This is a fairly new term here in the US, but it's actually been around since the 1980s when it was first introduced by the Japanese government. They were kind of the first country to come up with the definition for what a functional food is. In the US, the FDA, which is the Food and Drug Administration, regulates nutrition labels and claims that companies are able to make on their packaging. So this includes any health claims that you see on packaged food items. And a lot of professionals even consider the term functional food to kind of be more of a marketing strategy than anything else. And that's because we don't have an official definition for functional food here in the US. So the FDA doesn't currently have a concrete definition, but there are several organizations who have come up with their own. So we'll kind of touch base on what those are shortly, and I'll try to give you a little bit more context. But this is, something that's really quickly gaining popularity. So like I said, there's other organizations that have come up with their own definitions to try to help people understand more what functional foods are. And I wanted to just quickly point out the term nutraceuticals. This is a term that's commonly used interchangeably for functional foods, but there is a key difference. Nutraceuticals refers to bioactive components, and most commonly that means components that are found in supplement form. But functional food refers more to foods in their actual whole natural form. So that's what I'll be referring to when I talk about functional foods. Not so much nutraceuticals, but more functional foods. So let's take a look at some of the definitions that currently exist. The first one comes from the International Food Information Council, or IFIC. And this is a nonprofit organization that utilizes peer-reviewed information from a wide variety of practices, from the USDA, the FDA, the National Academy of Sciences. So they do a lot of peer reviews, and they've come up with this definition for functional foods, which is any food or food component that may have health benefits beyond nutrition. And then the second definition that we use a lot, it comes from the Institute of Food Technologists, which is another nonprofit that researches food science and food technology. And their definition is foods and food components that provide a health benefit beyond basic nutrition for a specific population. And these substances provide essential nutrients, often beyond quantities necessary for normal growth, maintenance, and development, and or biologically components that impart health benefits or desirable physiological effects. So these are kind of two definitions that a lot of research and information is based off of. So this is kind of what I'll be referring to when I talk about functional foods. And these kind of are a little bit wordy, so I'll try to break it down, and we'll take a look at some specific categories and types of functional foods. So there's two main categories, and those are conventional foods and modified foods. And then I wanted to also mention there's two other categories of foods that were once considered functional foods, but we no longer consider them to be in the category. And these are medical foods and foods for special dietary use. I'm still going to discuss these briefly just so that you have some more insight into how different types of foods can be used as medicine in their different forms. But I wanted to just make sure you know that when we refer to functional foods, we're mostly talking about conventional foods and modified foods. So we'll get into that next. I'll try to clarify. So the first category of functional foods is conventional foods. Conventional foods are foods that have been unmodified and unprocessed. So they're considered functional foods because they inherently have nutrients, such as antioxidants, and other health properties that are beneficial for our overall health and disease prevention. So just kind of some broad categories are fruits and vegetables, tree nuts and seeds, legumes, whole grains, seafood, fermented food products, and herbs and spices. So kind of simply put, conventional foods are foods in their most natural form. So they haven't been altered, they haven't been modified, they're just kind of foods as you would naturally find them. So we'll start by talking about fruits and vegetables. This is probably one of the largest categories. I just listed a few, but the amounts are really endless. And that's because there's countless varieties of fruits and vegetables, and they all have really unique nutrient compositions that provide health benefits. And this is primarily because they have high amounts of polyphenols, which reduces the DNA binding ability of carcinogens. And carcinogens are substances that can cause cancer. So polyphenols is an antioxidant that kind of prevents that formation of carcinogens. So just kind of to give some examples, tomatoes are really rich in lycopene, which is an antioxidant that's been known to reduce the risk of prostate, ovarian, gastric, and pancreatic cancer. And then we have kind of this list of fruits: berries, kiwis, pears, peaches, apples, oranges, bananas. They all contain water-soluble vitamins. So these are vitamins that are absorbed in the presence of water in our body. And they also are really high in vitamin C, which provides great immune function and, is great for disease prevention. Berries also contain something called ellagic acid, which is a really strong, has strong anti-cancer effects as well. And then lastly, citrus fruits, also really high in vitamin C, but they've been known to help reduce the risk of stomach cancer. And then looking at vegetables, there's just so many vegetables. I could do a whole presentation on them, but I wanted to really focus on kind of the leafy green vegetables. So broccoli, kale, spinach, cauliflower, zucchini. These all are really fibrous, dense vegetables, which is great for promoting gut health. It promotes GI motility. They contain those prebiotics, which feed our gut bacteria. And this helps reduce just your general risk of GI conditions, and also reduces your risk of colorectal cancer. And these also contain vitamin K, which aids in coagulation. So if anyone has coagulation diseases, these can help with that. The next category of conventional foods, which again, conventional foods is just foods in their natural form, is tree nuts and seeds. So this includes almonds, cashews, hazelnuts, pine nuts, pistachios, walnuts, peanuts, and then we've got kind of a variety of seeds, chia, flax, hemp, lots of different seed options. But these are all known to provide cardiovascular benefits. So they lower LDL cholesterol levels, and LDL is sort of that bad cholesterol that we want to try to have lower levels of. They also reduce triglyceride levels in the blood. So these all kind of help with reducing inflammation, reducing risk of cardiovascular disease, preventing blood clots. So these are all really healthy nuts to be incorporating into your diet. They also contain omega-3 fatty acids, which are those healthy fats. And they're also a really great plant-based source of protein. So in addition to these cardiovascular benefits, they also provide protein and they provide energy for our bodies. The next category is legumes and whole grains. So legumes includes beans, chickpeas, lentils, and these are all foods that provide protein, but they also provide fiber, which is really great for our gut health. Again, for promoting that gut motility, feeding that good gut bacteria, and preventing our risk of GI diseases. Research has also shown that soybeans, which soy is a little bit of a controversial topic among the oncology population, but the latest research shows that soybeans, which contain isoflavones, which protect against cancers. So they have a protective mechanism to them. Whole grains, oats, barley, buckwheat, brown rice, couscous, these are all grains that are high in fiber, again, for our gut health. They also contain B vitamins and trace minerals like iron, zinc, copper, magnesium, and all of these minerals help promote red blood cell distribution, which helps with oxygenation throughout our body, which benefits us in a lot of ways in terms of our cellular health, our cardiovascular health. These all contribute those nutrients. And the fiber content of whole grains has been shown to have an inverse relationship between whole grain consumption and colorectal cancer. So what happens is when your body is kind of fermenting or digesting these whole grains, the short chain fatty acids inhibit carcinogenesis. So they prevent those carcinogens from forming and multiplying in our bodies. And the next category is seafood. So I listed some of the seafoods or fish that are highest in those omega-3s. Obviously, the list of seafood is much more extensive than this, but salmon, sardines, anchovies, mackerel, cod, these are all really high in omega-3s, which are those good, heart-healthy fats. They promote HDL levels, which is that good high density lipoprotein cholesterol. They also promote brain function and they aid overall with our cardiovascular function. And fish is also a really great source of protein. So it, again, provides our body with energy. It helps with muscle and with tissue repair as well. The next category is fermented products. This is something that you might not be as prevalent in some of your diets, but fermented products actually have a lot of really good health benefits for us. So some examples are yogurt, kimchi, sauerkraut, sourdough bread, tempeh, which is a plant-based protein, and then just pickled vegetables. These all help promote our GI health. They help prevent chronic diseases like irritable bowel syndrome. And probably most importantly, they contain probiotics, and probiotics help feed our gut, our good gut bacteria. They help our bodies break down food, and it helps promote our overall GI health. And fermented foods also have been shown to help with blood pressure, with reducing risk of diabetes, obesity, and generally they have anti-inflammatory properties. All right, and our last category is herbs and spices. And again, the list is much more extensive than what I have provided here, but I wanted to just kind of highlight some of these herbs and spices that are used in a really wide variety of cuisines. So chances are you will find most of these in several different types of foods. Garlic, turmeric, cinnamon, ginger, cayenne, sage, peppermint, all of these have anti-inflammatory properties. So they have been studied and used in different cultures for centuries to help reduce inflammation in the body. Cinnamon has been found to promote glycemic control, so it improves your body's response to insulin, which helps with overall reducing risk of diabetes and promoting blood sugar levels. Sage has been found to help with memory and cognition. And then peppermint is a really interesting ingredient that has been found to help with irritable bowel syndrome. It can actually help relieve some GI symptoms. So this kind of sums up our list of conventional foods. As you can see, it's very extensive, and I kind of was only able to cover just a small amount of conventional foods that provide health benefits. It's the largest category of foods because it just includes foods in their natural form, and the amount of foods that have inherent health properties is really endless. But what kind of the main takeaway that I want you to remember from just this specific talk on conventional foods is that foods in their most natural form are going to provide us with the most benefits. They have inherent nutrients that provide health properties for our bodies. So the next category of functional foods is modified foods. So we just talked all about conventional foods, which is just foods in their most natural form. So now we'll talk about modified foods, which is kind of the opposite. It's foods that have been modified. And the processes of modifying foods are known as fortification, enrichment, or enhancement. And you might be familiar with these terms. You might have heard of them. But what I'll do now is I'll kind of talk about the specific differences and some examples of foods that fall into these categories. So the first one is fortification. Fortification, or foods that have been fortified, basically refers to the process of adding nutrients to foods that are not naturally occurring in the food. So examples of commonly fortified foods that you might even have in your kitchen right now is orange juice, which has been fortified with calcium, which promotes bone health. So a lot of orange juice has calcium added to it to try to enhance the nutritional benefits of it. Milk is fortified with vitamin D. You might notice when you buy milk, they'll have vitamin D milk specifically, and that is referring to the fortification process. You can also buy fortified milk alternatives like almond milk, rice milk, cashew milk. These are all things that have also been fortified, usually with vitamin D, but they will sometimes add other nutrients as well. Fortified grains, cereals, and bread products. A lot of times they will add fiber. They'll fortify with iron and with folic acid as well. So if you have any bread products or cereal products in your home, chances are they have been fortified with some extra nutrients. And then another example is eggs, fortified eggs. Sometimes they will add omega-3 fatty acids, which are those heart-healthy fats. They will add them to eggs to try to increase the nutritional benefits. The next way that foods are modified is through enrichment. Enrichment means adding back in nutrients to the food that were lost during processing. So what can happen sometimes during processing of foods is nutrients are stripped from the food. And so enrichment is taking something that was naturally present in the food and adding it back in. So an example of an enriched food is bread products. Bread products can be fortified, but they also naturally contain folate or folic acid and B vitamins. And during the processing of these bread products or of wheat, a lot of times these nutrients will be lost, and so they'll add them back in, and that's called enrichment. And then the last form of modifying foods is enhancement. Enhancement means adding back in nutrients that were never in the food to begin with. So you're kind of enhancing it. Examples of enhanced foods is margarine. They will sometimes add plant stanols or sterile esters, which can help reduce cholesterol levels. Sometimes beverages will be enhanced with energy promoting ingredients or caffeine to try to help boost the function of that food. And then omega-3 fatty acids are sometimes added to eggs, which is another form of enhancement. So next, I'm going to talk about the two categories that are no longer considered functional foods, but you might still encounter them a lot when we're just referring to food as medicine. So I wanted to make sure to touch on these items just so you're kind of familiar with them. The first is medical foods. And medical foods, according to the Orphan Drug Act, the definition of a medical food is a food which is formulated to be consumed or administered enterally. Enterally just means orally kind of digested through the GI tract like normal food would be, under the supervision of a physician, and which is licensed for the specific dietary management of a disease or condition for which distinctive nutrition requirements based on recognized scientific principles are established by medical evaluation. So this is kind of a really wordy definition, but essentially medical foods is referring to something that's typically utilized under the supervision of a physician or a medical expert. And sometimes it does require a prescription from your physician. Some examples of medical foods include tube feeding formulas. So tube feeding formulas are ingested enterally through a tube. There's lots of different formulas that are designed to accommodate different disease states or chronic conditions. Another example is an oral nutrition supplement. These can actually be found over the counter, but they are, again, designed to supplement somebody's diet who is not consuming enough with food alone. Some examples of this would be like Boost or Ensure, Novasource Renal. These are all examples of oral nutrition supplements. And you can get these in the hospital from a physician or a dietitian. You can also get them typically over the counter. And again, these are typically used under the supervision of a healthcare practitioner. So a doctor will write a prescription for you. A home health nurse will come help you administer your tube feedings if you are not in the inpatient setting. And then the last category of functional foods that, again, it's not a functional food, but sometimes people refer to this when talking about food as medicine, is foods for special dietary use. So the FDA Food, Drug, and Cosmetic Act defines foods for special dietary use as foods that supply a special dietary need that exists by reason of a physical, physiological, pathological, or other condition, supplying a vitamin, mineral, or other ingredient for use by humans to supplement the diet by increasing the total dietary intake, supplying a special dietary need by reason of being a food for use as the sole item of the diet. So essentially, kind of simply put, foods for special dietary use is a food that's designed for a specific population who have specific dietary needs. So some examples are infant formula or infant foods, like little, baby foods. Those were designed for a very specific population. Their nutrient composition is designed to meet the needs of that population. Hypoallergenic foods, which are foods that are, labeled as being gluten-free or not containing any of the top allergens, these would be designed to meet the needs of a specific population. Weight loss foods or weight loss programs. So I put there like Slim Fast, or if you buy like Zone bars or any of those things that are part of a specific diet program, those would be considered foods for special dietary use. And then also, through several different organizations, you can find meals that are specifically designed for patients who need, a diabetic diet or are receiving dialysis and need a specific renal diet, kind of all these different restrictions that might be in place because of a medical need. These would all fall under the category of foods for special dietary use. So even though these last two categories are not considered functional foods, they do still provide a lot of nutritional benefits when used under the care of your physician or a dietitian who can kind of provide more guidance into how to appropriately use them. So, where do functional foods fit into our diet today? The Academy of Nutrition and Dietetics, which is the nationally recognized organization for registered dietitians and nutrition professionals, their position on functional foods is that functional foods that include whole foods and fortified, enriched, or enhanced foods have a potentially beneficial effect on health when consumed as part of a varied diet on a regular basis at effective levels. So essentially, their recommendation for functional foods is that they can healthfully exist in a diet that also contains a variety of different micro and macronutrients from different foods. And you'll kind of see this when we talk about antioxidants next, but it's important to try to get as much variety as possible in your diet, because that will ensure that you're getting a wide range of nutrients. As you can see from all the different conventional foods, they all contain really unique properties. Some foods contain more vitamins, some foods contain more fiber, others have been enriched or enhanced. And so if we can kind of try to broaden the types of foods that we're eating day to day, week to week, that'll help make sure that our whole nutrient profile is met and that we're meeting all of our nutrition needs more appropriately. So next we will talk about antioxidants. And this is probably a term that most of you are familiar with, but we'll kind of briefly talk about what they are. Antioxidants are compounds that are found in foods. And what they do is they protect the body from free radicals. And free radicals are produced by normal body functions and kind of our daily activities. So breathing, exercising, stress, drinking alcohol, smoking, just breathing in the air pollution. These are all examples of ways that free radicals are produced in our body every single day. And what happens is free radicals attack our healthy cells. So we don't like having free radicals floating around in our body in too large of quantities. Antioxidants counteract free radicals. So they protect our healthy cells from damage that can be caused by free radicals. And they help to remove them from the body. Some of the most common examples of antioxidants, which we'll go into more detail, are carotenoids, vitamin E, vitamin C, and selenium. And just kind of as a disclaimer, we will talk about antioxidants and their health benefits, but just keep in mind that this information pertains to the benefits of consuming antioxidants from food and just kind of from whole foods, not from antioxidants in supplement form. So there is some research that shows that consuming antioxidant supplements might actually have adverse health effects, especially if you're consuming too high amounts. So before kind of taking any supplements or purchasing any, I would definitely recommend speaking with your physician. We'll kind of just be talking about antioxidants in their natural food form. So the first category of antioxidants found in foods is carotenoids. There's over 600 different types of carotenoids found in food. So carotenoids are, very prevalent in all of the different fruits and vegetables that we consume, as you can see with just the wide variety. Some of the most common, which you might have heard of before, are beta-carotene, lycopene, and lutein. Carotenoids help reduce inflammation, which has cardiovascular effects. It also helps reduce our risk of chronic diseases. They also help prevent cancer because they are an antioxidant. And like we just talked about, they help protect the body from free radicals and from cell damage caused by free radicals. They have also been linked to eye health. So lutein specifically has been linked to preventing macular degeneration. And then when you're thinking about foods that contain carotenoids, just think about eating the rainbow, colorful foods. So red, orange, yellow, dark green fruits and vegetables, sweet potatoes, spinach, carrots, tomatoes, bell peppers, Brussels sprouts, different types of squash, broccoli, all of these fruits and vegetables contain carotenoids, and they specifically get their color from the carotenoids. So the different type of carotenoid helps determine the color that you see when you're picking out a fruit or a vegetable. The next antioxidant is vitamin E. Vitamin E also has anti-inflammatory effects, which can benefit our heart health, protects our GI health. It also promotes eye health by working against cataracts. So it helps prevent formation of cataracts. And then foods that contain vitamin E are vegetable oil, wheat germ, whole grains, fortified cereals. So cereals where they naturally had vitamin E and they've kind of added it back in. Nuts and seeds, and different nut butters. These are all foods that contain vitamin E. The next antioxidant is probably one of the most famous antioxidants, and that's vitamin C. Some of the primary functions of vitamin C is it helps limit the formation of carcinogens, which are cancer-causing substances, by reducing damage from free radicals. It also helps promote immune function, so it can help prevent acute illness as well. It protects the body from infection. Vitamin C also contributes to collagen production. So it's really important in wound healing. In post-op patients, vitamin C can help promote healing as well. And then vitamin C aids in iron absorption. So anytime you're consuming a food that contains iron, if you're consuming it in the presence of vitamin C, that helps your body absorb the iron. And vitamin C is, a lot of people typically think vitamin C, they think of citrus fruits only, but it's actually found in a wide variety of different foods, such as bell peppers, those green leafy vegetables, potatoes, kiwi, strawberries, Brussels sprouts, spinach. These are all examples of foods that contain vitamin C. And then the last antioxidant is selenium. Selenium is not as well known to people, but this is a mineral that has antioxidant properties. So naturally, it helps prevent damage from free radicals, which aids in cancer prevention. It also has cardiovascular benefits. So it can help reduce inflammation. It also prevents platelet aggregation, which is when platelets in the blood clump together, which can lead to an increased risk of blood clotting. Selenium is known to aid in the synthesis of thyroid hormone and metabolism, so it can contribute to thyroid function. And selenium is found in Brazil nuts, organ meat, seafood. So lots of different seafoods contain trace amounts of selenium. It's found in eggs, and then it's one of the nutrients that is fortified in different cereals, grains, bread products. So now with all of this information, what do we do with it? How do we incorporate functional foods and antioxidants into a healthy diet? So I wanted to provide you with kind of some practical tips as well as some recipes just to help get you started on incorporating more of these things into your day-to-day food. So there's kind of four main things. The first recommendation is consume fresh, minimally processed foods. So this is kind of really trying to emphasize consuming more of those conventional foods, foods in their natural form that just inherently have really beneficial health properties. Fish, you want to aim for about 8 ounces a week, which is about 2 servings. So if you had, kind of 2 meals a week that had fish, you would be meeting the recommended needs. And fish contains those omega-3s, those really heart-healthy fats that can promote our cardiovascular health. Another example would be unsalted nuts. These contain lots of different vitamins. They contain protein, they contain heart-healthy fats. All of that contributes to our overall health. Whole grains are really high in fiber, which is great for our GI health, for preventing colorectal cancer, promoting gut motility, feeding those that healthy gut bacteria. And whole grains can also be fortified. So in addition to getting those benefits from the fiber, you also could be getting B vitamins, iron, folic acid, some of those things that are fortified in whole grains. Beans provide great fiber, great protein. It's a really great plant-based protein to try to incorporate into your diet. And that will help prevent you from consuming kind of darker meats and animal products that can contribute to cholesterol levels. And then lastly, fruits and vegetables. We kind of talked pretty extensively about just the wide variety of health benefits that come from fruits and vegetables. They all contain really unique properties. Think about eating really colorfully, eating a wide variety, and that'll kind of ensure that you're getting a good, well-rounded nutrient profile. And then kind of going along with that, the recommended amount of fruits and vegetables is about 1.5 to 2.5 cups per day. And keep in mind that they can come in different forms. So fresh, frozen, canned, these are all really nutritious ways to get your fruits and vegetables. A lot of people think that the nutrient benefits are compromised if you aren't eating, just fresh produce. But actually frozen and canned produce, it's all prepared and harvested at the peak ripeness. So, and then they will flash freeze or they will, can those fruits or vegetables right away. So very few of the nutrients are lost during that process. And this is also, it's really a great way to just make sure you're getting enough if you're not able to consume things before they go bad. So don't be afraid to incorporate frozen or canned fruits or vegetables in addition to fresh ones. And then the last two tips kind of go together, but if you are eating packaged foods, you want to avoid things that have added sugars and added sodium as much as possible. So sodium is typically used as a preservative. So you might find that in packaged foods, the sodium levels are much higher. And then sugar is typically added to a lot of foods to enhance the flavor. And foods that might not inherently taste sweet, if you take a look at the nutrition label, you will find that there sometimes is some added sugar in some surprising foods. So you want to really utilize nutrition labels when making these purchases and kind of when thinking about which foods to consume. And I kind of give a little bit of an example here with this container of Greek yogurt. So the little on the box that is circled in red, that's the line that has added sugar. So you want to really look at that line when you're thinking, does this food have any sugar in it? If you look at the line right above where it says total sugars, 5 grams, that's actually referring to natural sugars that are found in that yogurt. So this yogurt naturally has 5 grams of naturally occurring sugars in it. But if you look at the line down below, you'll see that none of those sugars have been added. And then you can kind of further investigate if you want by looking at the ingredient list. So if you look to the right of this nutrition label, I included the actual ingredients, and you'll see that the word sugar, cane sugar, high fructose corn syrup, glucose, these are kind of some of the words that are used to show when sugar has been added, and that's not included in this list. So that will kind of help you further know that there's no added sugar. So I wanted to also show some kind of general recipes and I'm happy to provide these if anybody wanted copies of these recipes, but these are all just kind of some different ways that you can incorporate more of these functional foods antioxidants into your diet. This first recipe, which is for tomato stuffed bell peppers, has lots of different antioxidants coming from the bell peppers, tomatoes, garlic, the olives. It also has really great fiber from the black beans as well as from the vegetables, which can help with our GI health again, and with reducing our risk of certain GI cancers. And then you can I love that you could customize this recipe. You can make it a little bit heartier if you wanted to add some light meat chicken or some ground turkey. You could increase the amount of beans. You could use quinoa instead of rice. You can kind of really change this up depending on your preferences. This next recipe is for a berry and spinach salad. And a lot of times people say salads don't feel very filling. So I like to always incorporate a little bit of protein, a little bit of fat to make this satiate you and kind of sustain your fullness for a little bit longer. But this combines functional foods and antioxidants. So the raspberries, strawberries, and spinach are all really packed with antioxidants. The avocado is an example of a functional food. It contains heart healthy fats, which will promote cardiovascular health, in addition to helping keeping you feeling satisfied and full. And then the chicken adds additional protein to help round out the meal. And then lastly, this pasta is again another great example of how you can incorporate antioxidants into something that like a pasta dish, which people tend to label as not being as nutritious or being more indulgent of a meal. But the tomatoes contain lycopene, which is one of those antioxidants we talked about. The spinach is also a great source of antioxidants and fiber. You can use whole wheat pasta instead of white pasta, and that'll give you some more fiber. Or if you prefer white pasta, the white pasta has probably been fortified with some of those B vitamins, folic acid, iron, so you'll still be getting nutrients from the pasta. And then the cheese, the goat cheese or feta cheese, that's an example of a fermented food, which we also talked about as one of our conventional foods that provides health benefits that is beneficial for our gut health. These are some sources for this presentation. And then I will open it up to our moderators if anybody has any questions or needs any clarification on anything I talked about.
Thank you, Brianna. That was just jam-packed with information that your brain is still, processing. But we do have quite a few questions, so let's just go straight to it. First one, yes, to reiterate, we will share the recording in about 2 weeks. You can go to torrancememorial.org/SBSC to access the recording. If you have celiac disease, what is the best grain to help with increasing iron and vitamin B and B vitamins?
Oh, that's a great question. Rice is a good option. Sometimes rice is fortified with those nutrients. You can also buy, like, any of the gluten-free cereals will typically be fortified as well. So that's a good way to kind of ensure you're still getting some of those nutrients. Also, iron is really prevalent in other foods that are not, don't contain wheat or gluten. So, beans, if you're having any of those heart healthy, fishes or light meat, you'll also be getting a lot of iron from those foods as well. Nice.
Wonderful. Is soy protein good?
Yes. So soy protein, like I mentioned, it does have some actually protective benefits. It's as long as you don't have a soy intolerance or allergy, soy protein is safe to consume.
Wonderful. What would be the preferred artificial sugar be? Is cancer love sugar a myth?
Yes. So there isn't a lot of research that shows proliferation of cancer cells in the presence of sugar. So I would say if you can stick to more natural sugars like, fruits, vegetables, honey, maple syrup, things that are just naturally inherently sweet rather than adding sugar to them, that would be my first recommendation. But it is safe to consume things that have sugar. Yeah.
Are there specific supplements cancer survivors should be taking?
That's a question I would ask your physician. You kind of would need a little bit more information to know specifically if you're deficient in something. Yeah.
Understood. Is one or the other absorbed better by the body to get most of it, liquid or pill form / powders?
In reference to antioxidants or specific vitamins?
I think just absorption rate, which is better to take.
Yeah, they both are pretty readily absorbed. It depends on the vitamins. Some vitamins are fat soluble, some are water soluble. So, that's why you might find like certain, like vitamin D or fish oil. Those are kind of in like little capsules with oils because those are absorbed in the presence of fat. So that's kind of a big difference. But if you're having a kind of well-rounded profile, your body should be absorbing a lot of these vitamins.
Wonderful. How do antioxidants work with chemotherapy? A chemo nurse told me to limit consumption, which I thought was odd. And then she found her list. It said, do not take vitamin A, E, C, CoQ10, any vitamin labeled antioxidant, no more than 1 glass of vitamin C, eat foods with vitamin A, C, or E in moderation.
I'm not totally sure. That might be based on the type of chemotherapy you were receiving. It's possible that there might be like some drug nutrient interactions with those specific ones. That might be a reason why it's recommended to limit those ones.
Wonderful. Would vegetable oil be olive oil?
Yes.
Okay. Yeah. What about propolis?
I'm not familiar with that. Propolis?
Propolis, Propolis.
I'm not familiar with what that is, if that's a type of supplement, but.
Okay. And then let's see, and you are okay with sharing the recipes. Great. Some grains or legumes or spices such as turmeric can be contaminated with lead. In fact, it's noted on the labels. How dangerous is this, or is it trace amount and should not be taken into account?
It's typically trace amounts. You would need to be consuming really large amounts of those to have kind of those risks, but they are required to label that and to kind of put that disclaimer out there. But if you're just using it to season something, you should be fine.
Wonderful. Why are tomatoes, the nightshade family vegetables, often recommended to avoid?
That's because they can have certain drug nutrient interactions. So again, depending on your specific regimen and what other medications you're taking, they might be recommended to be limited.
Should we take protein supplements or take protein from fresh foods?
So fruits don't typically have protein in them, but if you're able to consume all of these nutrients from foods, we always recommend that just because you are getting all of the additional nutrient benefits in addition to like just the protein. But if you are having a hard time consuming foods or you have increased protein needs for any reason, it is fine to incorporate like a protein powder into your food as well, or into a smoothie, or however you like to take it.
Wonderful. Brianna, it is 6:30. We do have a few more, questions. Are you able to stay on longer, or should we end the workshop here?
Yeah, I can stay on for a couple more minutes.
Couple more minutes. Okay. Avocado oil or olive oil, which is better?
They're both really great. I like both of them. Olive oil has kind of a more distinct flavor. So if you're, going with a recipe that needs a more flavorless oil, I would say avocado oil, but olive oil has really great cardiovascular benefits.
Awesome. There are some fruits such as loquats, cherimoya, that are said to be especially helpful for cancer. Are there studies that show these fruits are better than others?
Potentially, I don't know specific studies, but, depending on the antioxidant and the nutrients they provide, they might be linked to kind of helping prevent certain diseases. But in general, I would say all fruits are going to benefit you.
How many times a week should you eat nuts?
Oh, you could have nuts daily, as long as you don't have any sort of GI issues, IBS or anything like that, so diverticulitis. You could consume them daily. Yeah.
Can you eat too many fruits and veggies per day?
Potentially, if you have GI issues, that's kind of one of the main reasons we would recommend reducing it, is if you have GI issues or if you have diabetes and you kind of need to be monitoring your carbohydrate intake.
Because we frequently see changes in nutritional recommendations, for example, soy, what is the best source for evidence-based information?
The Academy of Nutrition and Dietetics, their website is eatright.org. They have really great up-to-date research. Registered dietitians are required to do continuing education. So we're kind of constantly sifting through the new research and trying to make sense of all of the, fact from fiction. So those would be two great resources. But the Academy of Nutrition and Dietetics is a good place to start if you're just kind of looking for yourself and doing your own research.
Wonderful. Is it better to only buy organic foods, fruits, vegetables?
Not necessarily. The Environmental Working Group has a list every year that they come up with called the Dirty Dozen and the Clean 15. And those are two different lists of fruits and vegetables that are known to be really high in pesticides and fertilizers, and then ones that are known to be really low. I recommend going off of those lists if you want more guidance of which ones are best to purchase organic versus non-organic. But there's obviously a price difference. So if your budget does not allow for it, I would say as long as you're consuming fruits and vegetables, that's the more important kind of goal to aim for.
Is it good to consume keto cereals and snacks, keto products?
I would say unless you have a specific condition where it's recommended, the keto diet is very restrictive, and it's best to follow that under like supervision of somebody who is familiar with the diet and can help make sure you're getting all of the nutrients you need on a very restrictive diet. So I wouldn't recommend it for just the general public, but if unless it's recommended by your physician.
Wonderful. If we take LEGI and fruits by cold pressed drink, how much should we take?
I'm not familiar with that food item, so
let's see. What kinds of cereals and milk are good to eat?
So ideally, you want to consume like a higher fiber cereal, something that has very little added sugar. Cereals tend to be a source of a lot of added sugar. So if you can find something that has limited added sugar, that would be ideal. And then in terms of milk, it depends if you're looking to boost your calories, you can always go for like a more full fat milk. Keep in mind that milk alternatives, so plant, almond milk, soy milk, those typically don't have as much protein as regular cow's milk does. So that's one key difference that a lot of people aren't familiar with.
Let's see. Oh, what about stevia? I think we covered that previously.
Yeah, stevia is okay to consume if you wanted to have a sugar alternative.
Okay. What kind of bread, eggs, and breads are good to eat?
Breads, again, it depends on your specific condition. They're all going to be fortified, which is great. We typically recommend like a whole grain, whole wheat bread, just so that you are getting all of those B vitamins and all of the great fiber.
It is 6:35, so let's do this as our last question. Can you talk about the safety of sushi or ceviche, like raw kind of fishes?
Mm-hmm. Yeah, so sushi generally is safe. I would not recommend it if you have a low white blood cell count, which would mean you are neutropenic. That means you're kind of at a higher risk for getting infection or getting sick from any little thing. So in that case, I would avoid raw fish or sushi just to kind of reduce your risk of getting infection or foodborne illness. Otherwise, you will still get the nutritional benefits, those heart healthy fats from consuming the fish if it's raw or cooked.
Wonderful. Thank you so much, Brianna. And then so just wanted to iterate for Miriam, she'll get the video posted, I said, on the website in about 2 weeks. Anyone who would want for Miriam to email them directly